Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for returning for another segment. In this segment, we're going to have a conversation with Beth Battaglino. She's joining us here as an RN and CEO of HealthyWomen to discuss a recent national public survey by the Alliance for Endometriosis, which revealed that 90% of people with endometriosis are disbelieved, dismissed, or even ignored by others at least monthly. Welcome to Health Professional Radio. Beth Battaglino, thanks for taking the time this morning.
Thanks for having me.
Well, as an RN and CEO of HealthyWomen, give us a brief look into your professional background and talk about your role at HealthyWomen.
Sure. So I am the president and CEO of HealthyWomen. I restarted the organization in 1997, and we are the leading national not-for-profit women's health organization. We provide digital information. So healthywomen.org is our site, and we provide medically vetted information on all women's health issues from A to Z. And I'm also a practicing nurse in maternal fetal medicine.
Why was the survey by the Alliance for Endometriosis conducted in the first place?
First of all, endometriosis is a condition that goes undiagnosed. Most women living with endometriosis have a 7 to 10 year period before they're accurately diagnosed with endometriosis. So there's a huge gap in education. There's a huge gap in awareness. And there's a need to bring this to the front table. As we go into 2022, this is unacceptable. I mean, we have cars that can drive themselves. We're sending people into space. The fact that we cannot diagnose endometriosis earlier, or the fact that healthcare providers are not diagnosing women earlier, the fact that women are not having conversations and then being dismissed about their signs and symptoms is not acceptable. So that's why it was so important for us to do the research, to understand what women are going through, women that are actually living with endometriosis, so that we can understand the gap and really start making movement in diagnosing and treatment options for women that are living with diagnosis to improve their quality of life.
Now, is this disparity in care, is it a result of physicians and healthcare providers just simply not knowing the intricate details of the condition? Is it women not asking the right questions, as you alluded to? Certainly, it's not just nonchalance about something so serious.
So, your question is a great one. And what our survey found is that people with endometriosis believe that there's a lack of understanding about their experiences with endometriosis by not only healthcare providers, but by friends, family, and of course, healthcare professionals. And for instance, 40% of the people that we surveyed told us that their symptoms are a normal part of being a woman. Right. So they're told that this is normal. Like what you experience, the pain that you experience each month is normal. 4 out of 10 survey respondents shared that the discussion with their healthcare providers are not open and productive. So they're not getting the answers that they're looking for, or the belief that they're actually going through this pain. And 70% believe that healthcare providers have limited awareness of the impact of endometriosis and wish that they understood the physical pain and the inability of participating in live events caused by endometriosis symptoms. So it's really a mix, and we've heard this, but now it's time to do some action, right? Because this should not be happening in 2022. So we are putting a stake in the ground, and we are determined to kind of fix and change how endometriosis is being diagnosed, making sure that healthcare providers have the tools and resources, and that consumers, that women know that this is not just in their head, that this is not something that they just have to live with, that there are treatment options, and that they should be able to have a conversation with their healthcare provider and find out what treatment is best for them. We know that one size does not fit all. And making sure not only do they treatment options, understanding their treatment options, but have access to the treatment.
So what are some of the aspects of the Alliance for Endometriosis action plan? I heard you mention going into action. What are some of the points of this action plan?
So some of the points is sharing the stories. We here at HealthyWomen know the importance of sharing stories, hearing from other women who are living with stories that can shed light and illustrate the unique experience of endometriosis. It's such a powerful tool. It helps kind of dispel the stigma that they may be feeling and make sure that they realize that they're not the only ones living with this condition. There are other women living with it, and they're living well, meaning that they've been diagnosed and that they are receiving treatment, and that it's a game changer. Also, educating healthcare providers, not only the physical, but the emotional, and educating them on the financial and the social impact of endometriosis, and using our research to support and validate different patient experiences. And last but not least is working with healthcare providers who may not be familiar with endometriosis to help them identify the signs and symptoms of endometriosis earlier and to foster more open and more productive conversations with their patients.
You know, I'm hearing being dismissed. I'm hearing being ignored. But what about misdiagnosis? I mean, you know, a healthcare provider sincerely trying to help the patient, maybe with limited understanding, but wrongly diagnosing as opposed to saying it's all in your head or this is not real.
Absolutely. That's a huge gap right now. And that's why it's taking such a long time, that 7 to 10 year period of being accurately diagnosed. So the more education we do, the more research like we've done with this great survey to make sure that healthcare providers understand that this is a real issue and that there's a huge disconnect, and the opportunity to do education and provide them with the tools and resources that they need to help them think about endometriosis when they're listening to their patients, and giving them the tools and resources to accurately diagnose earlier. And if we can change that, if we can diagnose women earlier, just think about the improvement of their quality of life. It's going to be earlier diagnosis, earlier exposure to treatment options, and their quality of life is going to improve dramatically.
When it comes to early diagnosis, at what point in a woman's life does endometriosis normally present?
No, it can present, what we're finding is it can present as young as soon as women start getting their period. So young girls early as 11, 12, 13, and then most patients experience pain, but when they're trying to start their family, trying to conceive and having difficulties, that's when many women are, realize that there's a problem and that they have endometriosis. So it's, learning and understanding earlier and making sure the conversations are had and that treatment options are discussed and making sure that women have access to those treatment options. That's our action plan.
Now, I heard you mention trying to conceive but experiencing pain. Does endometriosis render any patients infertile due to the condition, or is it once it's treated and the pain is alleviated, is conception, normally the way to go? Does it normally happen? Well,
no, that's a great question. So it's, again, every female is different, right? So the earlier that it's caught and treated, it opens up better chances of conceiving. There are women, and that then it puts you into a different game plan too, whether you can stay with your OBGYN or you may have to go to a fertility specialist. But there are options there, and that's what we want to make sure women are aware of, that, living with this constant pain is not normal. Being able to find a healthcare provider that you trust and you can have that conversation with is so important, and making sure that we're providing current information, resources, and tools to healthcare providers to help them with that earlier diagnosis and that early discussion of treatment with their patients. So there isn't a 7 to 10 year timeline before patients are diagnosed and may not be able to conceive because of endometriosis.
Well, if you would, give our listeners a website where we can learn more about the Alliance.
Absolutely. For more information, please visit allianceforendo.com.
Well, I appreciate you joining us here on the program, Beth. It's been a pleasure speaking with you, and hopefully you'll return for another segment.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Beth Battaglino. Audio copies of this program are available at hpi.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.